Right. Well, good afternoon, or morning, or evening, no matter where you're joining us from. This is Brandon with National Minority Equality Forum. Make sure my bio. Yeah, so just glad to be here today, and we're going to talk all things women's maternal health or vaccinations. But it's interesting. We have people from our first 40 under 40 class, both moderating and participating in our most recent 40 under 40 class, that's sharing their expertise along with a couple of others that one with our usual goal of educating folks on a Friday afternoon. Before we begin, if you have comments or questions that you'd like to ask our esteemed panel, make sure you put it in the Q&A box. If you have anything that you just want to let the group know or ways you want to chime in, please put it in the other box. And that's all I have. We have a team of experts, starting with Shyrea, who's been with NMQF since I've been with NMQF. Sharia's been with NMQF. She's in our first 40 under 40 class. She works with us in our company, Iris Collaborative. She works with us at the Fund 2 Foundation, and she's always just helping us along the way, and she's helping us today. So I'm going to turn it over to Shyrea Thompson.
Well, thank you, Brandon. I love collaborating with you and the MNQF team, and I'm excited to also be here today with this incredible panel and the folks at Pfizer that are amplifying this conversation for maternal health vaccination. We do know that an intervention to protect our most vulnerable is really key. And I thought today, being that it's October 4th, we would also recognize that it commemorates the passing of Henrietta Lacks and the announcement of her HeLa cells. When you think about her as the mother of modern medicine and the vaccines that she's advanced, we want to recognize that. I think it's fitting because it certainly reflects how important access for mothers all over the world, birthing people and their infants and families are. So we're going to talk more today about pregnancy and vaccination and explore what that looks like. We're going to talk about the role of the perinatal care team. That could be your physician, your doula, community health worker. And we're going to talk about how we can all play a role in advancing equity in vulnerable communities. So if you are joining us in the chat, feel free to connect. You're able to share resources, say hello, let us know where you're working from. And if you have any questions, we're going to be taking those as well at the end. So thank you so much. I'm going to go ahead and get started with our first panelist, and we're going to just do quick names and organizations, and then they're going to tell you more about the work that they do. Today we have Dr. John Iligan. He provides care at the Maternal Fetal Medicine Department of Obstetrics and Gynecology at Columbia University Irving Medical Center. We have Emily Rodriguez, that's the newest 40 under 40 that Brandon mentioned, who is the founder, and she is the founder of Ashe Birthing Services. She's also a doula and a medical anthropologist. In addition, we have Dr. Latasha Sylvie Perkins, who also with me is part of the inaugural class of 40 under 40 at MNQF. And she serves as assistant professor of medicine at Georgetown University School of Medicine. And she also provides care here in the DMV, as we call it, so the Greater Washington Metropolitan Area at MedStar Health. So thank you all for joining us. I'm going to go ahead and open with our first question. So we're going to start off by really just talking more about what role do you play in the effort to protect our most vulnerable. And so today we know those are birthing persons and people and their families and infants. So we'll start first with Latasha, if you'd like to share.
Sure. Thank you, Shyrea, and thank y'all for having me today. I am Latasha Sylvie Perkins. I'm at MedStar Georgetown University Washington Center in Georgetown in DC. And what I do is I'm a family physician. And as a family physician, we do collaborative, coordinated, continuous care. Family is in the name. And so we are a part of the team that also helps with prevention. Prevention is a large thing, and it's a big thing of what we do as a family physician. We're there to help inform our patients about everything from chronic medical diseases, but in this case, prevention around vaccines. We work with the community in a collaborative care model. In my clinic, for instance, I train medical students, I train residents, but I also work with social workers, community health workers, getting out the information that we're learning and we're training our providers with, but also collaborating to be able to get the information out and address any concerns around vaccines or any information. So we are there to provide information, to provide medical care, and to be a source for our community.
Thank you so much. And when you talk about community, we know that's what doulas do often. So I'm going to head over to Emily to tell us a little bit more about your role. Emily?
Hi, I'm Emily Rodriguez. I'm so happy to be here. I'm a birth and postpartum doula and medical anthropologist that specializes in birth in the United States. My work focuses on addressing bias and racism on an institutional and structural level, while also helping people reclaim their power and heal their lineages, like one birth at a time. I have a doula organization called Ashe Birthing Services based out of the Bronx, New York, that serves 400 families a year, 90% of which are Black and Brown families, and a tech platform called the Bridge Directory that's on a mission to heal the disparities in healthcare from within by training institutions and providers, redefining expectations in care, and closing the access gap. This is particularly important because here in New York City, Black women and other birthing people are dying at 9 times our white counterparts. That's 20 people a year. And the CDC has stated that more than 80% of those are preventable. So I'm attacking these issues from all sides as a mother, a birth worker, a researcher, and a Black woman in my community.
Yes, I love that approach. So you also have a colleague on the panel that's also based in the New York area as well. And I'm going to actually, Dr. John, if you don't mind, introducing yourself and also saying your last name. I want to make sure I'm saying it correctly and doing it justice because I also have a tough name and I would like to afford you the same courtesy. So I'll let you introduce yourself to the group.
Thank you very much for the invitation. My name's Dr. John Elagan, and I'm a high-risk obstetrician or maternal fetal medicine specialist at Columbia University Irving Medical Center. And I'm there also the medical director of our antepartum and postpartum units. I have my own practice within the faculty practice, but my connection with vaccination kind of dates back to the recent pandemic. And the communities that we serve are Harlem, Washington Heights, the Bronx, and historically, patients have been underserved from those areas. And also there's some degree of skepticism, some degree of hesitancy for vaccination. And, it was a real effort, I would say, during the COVID pandemic and soon thereafter to get people vaccinated. And, we made every effort to help dispel the myths, help educate our patients, and encourage vaccination. So that's sort of my passion behind this involvement. And thank you again for welcoming me.
I love it. We love to see clinicians that are passionate and caring and community-based. We're going to start off with kind of the 101, just in case you haven't heard about vaccination or immunization. Doctor, can you tell us a little bit more about what are vaccines and what are vaccine preventable diseases? And then we're going to go more into the schedule and all the things that we need to know. But we'll start off with, what is it?
Thank you. So vaccines, also known as shots, are liquid suspensions of attenuated live viruses. Those are slowed down viruses so they won't cause disease. They may include an activated mix of proteins of bacteria or viruses or genetic material that can help induce immunity. Some are highly defined, like hepatitis B vaccines, which many are familiar with, or polysaccharides of Haemophilus influenza type B, many of which, if you have babies, if you have little kids, I'm sure you're familiar with. Others are more complex or incompletely defined vaccines like live attenuated viruses like measles, mumps, rubella, varicella, chickenpox, or Bordetella pertussis like Tdap. And vaccine preventable diseases are basically those diseases that can be prevented by vaccines. And those could, like I said, could include viruses or bacteria. Unfortunately, tens of thousands of people in the US get sick with vaccine preventable diseases, which is unfortunate because largely a fair share of them are preventable. It may result in hospitalizations. Sometimes these diseases can be fatal under the worst circumstances. And of course, we want to promote vaccines because they're our best protection against these diseases. Vaccines also help reduce the incidence, the numbers of them, and also can even eliminate health threats if a critical mass of people are vaccinated.
Thank you. That was really helpful. And I know there's been so much more knowledge, right, in the public ever since COVID and talking about pandemics and even learning more about public health. So I appreciate you opening up with that. We're going to ask a little bit more about what vaccines are recommended during pregnancy by the advisory committee on immunization practices? And then what's the recommended schedule for maternal vaccines? And I know you talked a little bit about why it's important for pregnant people and their babies already. But if there's any other points that we should know as caregivers or birthing people or community health workers.
Sure. So, briefly to go over those recommended vaccines, the committee you mentioned, Advisory Committee on Immunization Practices, they make the recommendations and pass them on to the CDC director. And then once approved, it becomes official CDC policy. So sometimes it's a little confusing when you hear ACIP vaccines or CDC recommended vaccines. One is basically the precursor of the other. So they're more or less the same. But to answer your question, there are 4 basic vaccines that are almost universally recommended. There's the flu shot, influenza, Tdap, tetanus, diphtheria, acellular pertussis, the RSV vaccine, which Dr. Selby Perkins is an expert on, the COVID vaccine, which of course we've heard a lot of in the news, critically important. And then there are other vaccines that may be indicated if in the right scenario. For example, tetanus, diphtheria, considered safe in pregnancy, hepatitis A, if someone's at risk or may be exposed, pneumococcus or meningococcus, if you're in an area where it might be endemic or you might be at risk, like, tight quarters, dormitories, et cetera, and hepatitis B, if you haven't received the vaccine previously. Other vaccines that are not indicated, contraindicated, are those essentially live viruses. Even though they're attenuated, like measles, mumps, rubella, varicella, those are live, and theoretically they might cause infection, although I believe measles and varicella have not been shown to do that. And then there's HPV vaccine, which a lot of young women are getting to help prevent cervical cancer. Even though it's not a live vaccine, still is considered contraindicated because we simply don't know enough. But in terms of the schedule, influenza should be given to all women who are or will become pregnant during the flu season, plain and simple. You'll only get it in the fall and in the winter if necessary. You won't give it in the spring or summer because it's not in season. Tdap is considered a universal vaccine, which should be given between 27 to 36 weeks. And of course, it includes tetanus, diphtheria, acellular pertussis. As I mentioned before, if someone's never been vaccinated with tetanus or diphtheria, they can get this shot, but then they would get the follow-up 2 shots afterwards, just TD. But the purpose of this shot is basically to protect the baby that's to be born against pertussis, the infection, whooping cough, commonly known. And then there's RSV, which is newer on the market, which basically is given to pregnant people. It's a one-time dose from Pfizer, which is the only approved vaccine on the market. It's given between 32 weeks to 32 weeks, 6 days. This vaccine similarly is to help prevent RSV-associated infections in infants under the age of 6 months. Unfortunately, we can't vaccinate those newborns, so this is our best bet to do antenatally. And then the COVID vaccine. The COVID vaccine, at least the updated COVID shot, should be given to anybody age 6 months or older, and in this case, anyone pregnant who hasn't received the updated shot. You would like to give it obviously for maternal benefit, but you can confer some immunity to the newborn as well.
Thank you. And I know you highlighted yesterday that the CDC has a number of resources, so I'll drop that in the chat as we head into our next question as well. If anyone has questions or looking for additional information, we know that there is so much out there, right, when you're on your maternal health journey that we're navigating. And just like COVID was new, I think birth workers are certainly not new, but what I'm excited about is how much more attention and support they've received, not just from the conversation and being embraced further by community medicine, also by our administration as well. So I'm going to let Emily tell us more about what are doulas and how do you support pregnant people on this journey in their journey with maternal vaccines as well. Emily?
Thank you. So a birth doula is a non-medical provider who helps guide pregnant people and their families through pregnancy, birth, and postpartum. So we do this through physical, emotional, mental, and sometimes spiritual support. We advocate for our clients so they feel seen and heard throughout their pregnancy and birth. We want them to feel empowered no matter how they give birth and informed to make decisions that are right for themselves and their families. So doula support looks very different for every person. Sometimes the family hires us to normalize labor and provide counter pressure. sometimes because they're scared to navigate the system by themselves, and sometimes because they just want a third party to present them with all their options. So we adapt ourselves to each family and hold their hand in whatever way they need. We also fill in the holes in the system. So nurses here in New York City are understaffed and have many patients, but as soon as I change a Chuck's pad, the whole vibe in the labor room changes. So we're part of the birth team and another set of eyes. In medical emergencies, we're often the person explaining what is happening to the mother and reassuring her. And then once discharged, we provide continuity of care, checking in on the family at home, on call 24/7 for any questions and concerns, and looking out for any signs of PMADs, which are perinatal mood and anxiety disorders, and any signs of infection or concern.
Thank you so much. And I know you're helping to improve maternal health outcomes, and that's what really matters, right? We want to have safe birthing people, safe babies, safe families. So thank you for that work. We're going to head over to Dr. Latasha, and she's kind of also in that same position of wearing two hats, working in clinic, working also in community, and being a birthing person herself. So I am going to ask a little bit about both, Latasha. And we want to know, when it comes to maternal vaccines, how do you engage with your own patients? How are you engaging with your community? And how has your experience as a family physician impacted your own maternal journey?
Thank you, Shyrea. I will start with the second part of that question, right? How did it impact my own maternal journey? A story I've told for the 100 Black Stories or the Nurture You series, so Nurture Her series, but I was 37 years old, so advanced maternal age. I'm gonna say that, Dr. Ilagai, my soul will not let me say gestation, geriatric pregnancy just yet. I'm still pray for me, still working on that. But I advanced maternal age, gestational diabetes. I went into preterm labor, and my child was breached. So when it came to tools that could help me during the height of the Black maternal health crisis, so I was pregnant in 2018 when it was headline news. So any tool that I was given that would help protect my baby, I did it. So I was vaccinated. I got vaccinated for both the Tdap as well as the flu, because I was also having a winter baby who was going to be born in January 15th to be exact. And so I couldn't protect her for 6 months. And as a physician, I also know if your baby gets a fever in the first 30 days, she gets a spinal tap. And I was not having that happen because, again, there are a lot of vaccines that you can't get until your child is 6 months. So when I studied my body and thinking about the things that I could do in my own body that are my choice, and this human being growing in my uterus, I thought of the Henrietta Lacks and Anarka and Lucy and Betsy, the mothers of gynecology, and all that they did to allow me to have access to these tools and have access to be able to protect my child from getting sick and myself getting sick. And I was like, give me all of it, and this is how I want to do it. Now, going to the first part of my question, how do I use that to help my community, help my patients? I want my patients in my community to have the same information and be as educated and as informed as I was. It's ultimately their decision. But my job is to ensure that they have the information that they need and that they know that I am merely a part of the team, right? We have doulas, we have doctors, we have nurses, we have community health workers, we have family, our mothers, grandmothers who are a part of your tribe. But it is my job to make sure that you have all the information as your sister doc to be able to make the informed decision that you should make for your body and your family. And so that's how I see it. I'm a part of the team. And for me, there was no choice. I was using all of the tools, but that is a choice that every patient and every community has to make for themselves.
That's so true. And thank you for sharing that, because we know there's a duality, right? You're not just giving care, you also are on your own journey as well. And you highlighted what actually is a great lead into our next question. We know that care is a team model, right? Or when it's administered best. So when we think about that team, Emily or Dr. Ilagan, do you have any additional points that you'd like to highlight about what that care team looks like when it comes to maternal vaccines and what those roles are? I'll let Emily start us off.
Yes, thank you. I forgot to answer that part of the question. So for doulas, we're unbiased support people. So we're providing evidence-based information, encouraging our clients to continue those conversations with their providers at their next appointment. So Like, we've already stated, the CDC recommends the Tdap vaccine, the flu vaccine, COVID, the other vaccines as well. So for doulas, it's not necessarily about promoting and discouraging vaccines, but rather ensuring people feel heard, informed, and respected in the decision-making process, as Dr. Perkins said.
Excellent.
So from the physician perspective, I can tell you that we, like other providers, we play a critical role in ensuring that patients are safe and have the best possible care. And it's been shown that if a physician or if another OB provider were to counsel, discuss, offer, and even provide a vaccine, then within their office, then the chances of vaccine acceptance are 5-fold to 50-fold higher. So really, based on this alone, it's our role to review a patient's vaccination status to see if they have gotten it or need to get it, counsel them, recommend, and possibly administer the vaccine if they are eligible.
That's really helpful. And I think when you think about that, we know that there's a lot that goes into that conversation and that journey that patients experience. Sometimes it's a conversation not just with the birthing person, it might be a family discussion. And so, what have we seen as some of the best practices in maternal vaccines? And then, what gaps or common issues have you seen? And then how do you think they can be best addressed? And we'll actually start with Latasha and then kind of roll through the panel. Maybe we'll use a yes and. So if someone already said your best practice, roll to the next one because we want to make sure we can leave time for questions. So Latasha, Dr. Latasha.
So my yes and is there's this thought that Black and Brown communities are going to be hesitant. And that's an assumption. What we want to make sure that we do as physicians is that we listen, and anybody on the team is that we listen, and if there are some concerns, that we address and validate those concerns, because historically medicine has not been great to Black and Brown people, right? So we want to make sure that we're validating people's concerns and we're able to answer the question. And the second part would be what I do. Tell your story. Studies also show, as a physician, if you say, so these were my concerns with the vaccine, vaccinating my kid or vaccinating my own body. And so as a physician, if you share that, that also helps people be more informed. So continue to be informed, continue to validate and listen, and then also share your own story, because studies do show that helps.
Yes, yes. And I love that we're talking evidence here. I remember in the early days in this work, oftentimes those quantitative pieces and qualitative pieces were always, kind of at odds. But we know that the power of storytelling actually is evidence-based and can certainly make an impact in those trusted voices. So I'm going to go to our trusted voice on the panel, our doula. Emily, can you share what your yes and would be?
Not the trusted voice. So with my clients, there is a lot of vaccine hesitancy expressed due to medical mistrust and ongoing racism experienced on a daily basis for most Black, Brown, and Indigenous people. So factors like economic instability, lack of access to healthcare, education, neighborhood conditions, social environments, all heavily influence both access and attitudes towards vaccinations. So these social determinants can contribute to disparities in vaccine rates and health outcomes because of this deep-rooted mistrust in the medical system due to historical events like we talked about, like the Tuskegee experiments, Henrietta Lacks cells, the polio vaccine trials. So this makes conversations about vaccines complex and very sensitive. So my clients often tell me they're concerned at the lack of research on pregnant bodies, since historically pregnant women have been excluded from many clinical trials. We have already talked about this before, but I think transparency and informed consent is super important for addressing this. There's a need for more transparency around what is known, what isn't, and the risks and benefits for each vaccine.
That's so true. And I think you are bringing up a timely point, which I think so many people were excited to hear, that there's going to be more of an investment in research in women so we can get better treatment and care, especially when Ms. Lacks was so much a contributor to this advancement. We want to make sure we can all avail ourselves and get the best point of care and that medicine that works for us in treatment. I'm going to head over to Dr. Ilagan. Do you want to share with us what your yes and is?
Yeah, so, as others said, I mean, educating and listening to the patient is really tantamount importance because you can't know where they're coming from without hearing their own stories. And I loved what Dr. Selby Perkins said is, share your own experience. That really personalizes it, builds trust, shares in maybe some questions or some concerns about getting a medicine. Pregnant women don't even like to take Tylenol, let alone Benadryl. And then now you're giving a vaccine that may, as Rodriguez said, may not be as well studied because it's only been in the market for 3 or 4 years. And even though, yes, there's evidence, yes, there is good support to show that people can, for example, avoid the flu, have a better chance of avoiding flu, not 100%, and avoid hospitalization, reduce their risk to the pregnancy. We're talking about preterm delivery, stillbirth. Those are still significant issues. And, sometimes you have to discuss the approach of not just for the mom's risk, but also for the baby's benefit. And I think that tends to help. But to answer your question, look, sort of the nuts and bolts of best practices, of course, I think I mentioned before, review their immunization history, make sure they don't have any contraindications or allergies, have the vaccine prepared and administered within your office. That helps tremendously rather than sending them off to CVS or some other location, because that adds one more step that might cause a patient to fall off. Documenting and storing the vaccines properly, because we know that if they're not stored properly, they can go bad. Avoiding expired vaccines. And then, of course, coming back after all that discussion and readdressing if there are any concerns, sort of close the loop.
Yes, no, that's excellent. So as we close the loop on some of our open-ended questions to the panelists, so if you're joining us and you've got a question, go ahead and share that in the chat. We're going to ask our last all panelists question and head to our open Q&A in one moment. So my last question for all of the panelists is, how can we take what we know, right? You just highlighted a number of things really to improve maternal and infant outcomes. And also, what role can community play in this as well? And we know that might look different across the country. So if you've got examples in your own community, we know vaccination is not just a US-based issue. Internationally, there's other models as well. So I definitely encourage you to share whatever you would suggest for what that looks like in community. We'll actually start this time with Emily.
Thank you. So I think improving outcomes through maternal vaccination requires a holistic community-driven approach that addresses underlying issues we discussed here. Maybe that's by extending hours at clinics, leveraging mobile clinics and community health centers, making sure community health workers are up to date with the latest recommendations and evidence-based information. So community partners like social workers, doulas, midwives, other community leaders already have the community's trust and are great non-judgmental and supportive messengers for information. Community partners can facilitate safe spaces for discussions like these. They can also strengthen communications between providers and their patients by ensuring that pregnant individuals fully understand the recommendations given and feel empowered to ask questions and advocate for themselves.
Yes, that patient empowerment piece. Dr. Latasha, would you like to highlight? I know you're doing some work in this space and have in churches. So I'd love if you could share some of that, what you did even during COVID. I know it might not be a one-to-one with the maternal community, but I do think it's an excellent model for those joining us today. Dr. Latasha?
Yes, that's so important. So I'm a family medicine physician, so family's in the name. And so I also teach community-based learning at Georgetown Medical School. So what I did is I am family. So when it comes to the COVID vaccine, I learned as much as I could about the science and everything about evidence behind COVID. And I held town halls at my church. So I'm the DMV, I work in DC. I see patients in Maryland at the Hello Ford Lincoln, where we treat 90% Medicaid and Medicare patients. And then I live in Virginia. So I did town halls at community centers in Prince George County. I did town halls at my church, the women's Bible study. I went to the social services for foster parents and talked to them about the childhood vaccine when it came to COVID. And so it's important that community is a big part, and that not only, as Emily said, the community workers, but that the community workers are not only educating the population, but they're also educating the providers. I bring community workers in to educate my trainees because they need to know about the community, the hesitancy, and even the questions that are there. And so it's important that it's a bi-directional education, and it's important that our community knows that we are there for them, and that we can also be a trusted voice. If you love your primary care doctor is always going to be there to help you. And we also help coordinate care with specialists like Dr. Olagon. So we're also here for the team.
That is so true. It really is a bi-directional opportunity to learn. And I think that's been one of the themes we've heard today. We know that in this instance, we've got to listen and consider, where we need to reach patients, whether that's live, work, play, or pray, as I like to say. But in addition to that, making sure that we create the time and the opportunity. And as Dr. Ilagan said, close the loop as well. We're going to take questions. I'm going to actually open with one that we were really excited about in the prep session. So I'll take a point of privilege. We are going to start off first talking about policy. I mean, you can't come to a National Minority Equality Forum webinar and not get a little policy in. So what do you think we can do in this space to advance maternal health interventions through advocacy and policy? And so we know that might be with patient advocacy, but there also can be direct legislation as well. So I'd love to hear what you may think in that space. And I'll actually start with Dr. Ilagan, if you'd like to share anything that you would recommend or have seen work.
Well, I mean, in terms of policy, there are the existing ACIP and CDC policies, which are out there. The doctors, the midwives, the physicians, the healthcare workers, all who are involved in obstetric care are and should be aware of them. But in terms of policies, that is somewhat at a national or at a state level. And one thing that can be ensured or aided in delivering the vaccines or helping is to actually make sure that they're physically there. It is, I can tell you, a little bit of a challenge if you have someone, different offices, some having the vaccines, some not having the vaccines, and if you add another step of forcing someone to go to the pharmacy or go to refer to another location, that is one point where the patients can drop off. So having access to the vaccines is hugely important, just like access to other medicines and care that we commonly see in medicine. So access is one thing. I think, education, community education is like what Dr. Selby Perkins is doing, reaching out to the churches, being involved in your community is hugely important. I mean, in my instance, my community is the antepartum and postpartum floor. So I see all the patients on my units, the two of them, and, just talking to them one-on-one, making sure that they're aware of the benefits. And I know we talk about Black and brown communities having hesitancy. The truth is there are many people across all spectrum that have hesitancy, and it could be, just the desire to have a quote unquote natural pregnancy. We hear that a lot. And, you don't have to be of any background to have that opinion. And, we have to remind them that there is good benefit. There's good science behind this and good evidence to suggest that they can help avoid serious infection for themselves, which could affect their pregnancy, and it could help their baby even after birth. And I think that kind of focusing on the infant health can help persuade or convince the patient of the importance. But, none of this should be coercive. It shouldn't be like, oh, if you don't do this, I'm not going to do that. It should be sort of like what we do with genetic testing, shared decision-making. So for example, if someone wants an invasive test to know about a genetic condition, they have to agree to it. If someone wants a C-section, they have to agree to it. It's the same with a vaccination. The patient should feel comfortable, well-informed, and consented adequately before they get the vaccination, if that's their choosing. And so that takes effort on our part. It takes effort to explain things in a language that is easily understood by the patient. And of course, like Dr. Selby Perkins is doing, reach out to the community.
Yes, yes. So reaching out and engaging. I love that highlight. We're going to head to Emily, if you'd like to share.
Yeah, so we've talked about access, improving cultural competence, building trust, and ensuring vaccines are affordable and available so that we can reduce maternal health comes. But as doulas begin to accept Medicaid in New York City and New York State and across the United States, we can significantly impact the landscape of maternal health care, particularly when it comes to addressing these inequities. So by integrating doulas into Medicaid services, we can address both the financial and cultural barriers that prevent many low-income and marginalized families from receiving necessary health care, ultimately improving maternal and neonatal outcomes across the board. At my organization, the Bridge Directory, through our network of BIPOC providers, we advocate for maternal health policies that are grounded in anti-racism. So this means pushing for healthcare systems to acknowledge and address racial disparities. We advocate for policies that train healthcare workers in cultural competency and anti-racism, ensuring that pregnant individuals of color receive respectful, high-quality care that improves maternal health equity. We are also largely engaged with policymakers to influence maternal health legislation. So by providing expert testimony, collaborating with advocacy groups, and mobilizing community members, we push for laws and policies that prioritize maternal health equity, like advocating for comprehensive prenatal and postpartum care, improved access to midwives and doulas, and policies that ensure maternal health care is affordable and accessible for everybody.
Yes, yes. So again, raising our voices together to get that actually advanced. And I love that because we know that oftentimes I'm a former Hill staffer. That really is the most important and pivotal voice you are going to hear from, right? Your own constituents, your own patients, your own people, your own doctors, your own community members. So thank you for that work. Dr. Latasha, I know you spend some time on the Hill each year as well. So please share what you might, whether it's legislative or in general advocacy work.
I love to empower my patients. Advocacy work does not have to be done by Dr. Latasha Selby Perkins. It can be done by every single person. And when it comes to legislators and influencing legislation, they want to hear from their constituents, just like you just said, Shyrea. So I encourage, living in DC, you can go to the Hill and talk to them. You also can start at your ward level, at your neighborhood level, at your state level. I encourage and empower my learners, but also my patients to be empowered to be able to give your own testimony, because those stories are the ones that make a difference. And so you don't have to be a physician to be able to give your testimony, give your story, which also ends up influencing legislators. That's why we have acts like the Mama Act, and we have the big blueprint around maternal health that this current administration put together. Take a look at that. Have ownership of that. There's something you don't like, go to the Hill and talk about it. And so that's what I like to do in my community, is also empower every individual to know that you can speak to legislators yourself, and you also can give expert testimony. So make sure that your voice is being heard as well.
Exactly. We are experts as well in our own lived experience, and they work for us at the end of the day. And I love what you said about local, because we all have an opportunity. You don't have to get on a plane or a train or head here to move these issues. And if you think about it, right, the current landscape with Medicaid, Medicare, all of those pieces, right, are very much anchored in your own state and in your own community. So if you're interested in learning more, I know National Minority Equality Forum does work at the policy level. But if you have a resource that you'd like to share in the chat, feel free. If you have a question as well, feel free to submit that. I'm going to ask a little bit more about what is the progress that you've seen in the space, and maybe if you are willing to kind of highlight what you think is the future of maternal vaccines. We know there's so much advancement, even in technology. So I'd love to hear Dr. Ilagan, if you'd like to start us off.
Well, I can tell you that, since the pandemic, overall, I would say vaccine hesitancy has decreased somewhat, especially in our minoritized communities. And I think a lot of that has to do with the efforts in education, sort of at the ground level with our own patients, but also within healthcare forums that are hosted by various insurance companies. Even the insurance companies not recognize the importance of this, and so they have honestly a healthcare role, but also a financial incentive to help reduce this vaccine hesitancy. But I would say that fortunately it has gotten better. It's not totally gone, of course, and the continued effort really has to be either one-to-one education, as we mentioned before, or through involvement within your community. And I think we're getting there, though. I think I can even see, since the pandemic, people have kind of reverted back to wearing masks and taking care of themselves. And with the pandemic, as people wore masks, the flora or the mix of viruses has changed and shifted. So we saw very funny things like human metapneumovirus, flu in the summer. All kinds of adenovirus, rhinovirus that you typically wouldn't see during the summer months. And a lot of people were getting sick. And I think that sort of heightened awareness of the whole community has really added benefit to our patients that we serve in, like I said, in the Bronx, in Harlem, and in Washington Heights.
That's an excellent point, right? Seeing that behavior shift. I think as the world came together, right, we also came together to look at education in a different way, and making sure that we also were active in educating ourselves, our patients, our communities. And I think that is very telling about the future, right? And it has shifted even the way we look at public health. So from that perspective, with community, Emily, would you like to share what you see from the future within your lens?
Yeah, I think to echo what he said, we're seeing an increased uptake and awareness around vaccines. We're talking about it. There are clear guidelines from health organizations, more research on safety and efficacy. We talked about the development of new vaccines with the RSV vaccine in 2023. And just, the global impact and the focus on reducing disparities on a community level.
Yes, thank you. And I think that's also one of those outcomes, positive outcomes, right? From COVID, the world has gotten smaller and we're all working together more towards this. Dr. Latasha, what does it look like in your space, or what are you anticipating for the next step for us?
What makes me excited is some of the results from the legislative advocacy work that's happening. At our clinic, we have a grant that covers perinatal community workers. We have more grants to kind of get that information out to the community and have that bi-direction. That came because of advocacy work like what they're doing at Ashe and also our community workers here. So just the fact that that's happening and that the team is broadening in a way that is economical, but that we can pay for it and our patients have access to it is very exciting. And I will admit, I am excited about the new vaccine, the maternal RSV vaccine, because I was definitely afraid of my kid getting it. And now there's a vaccine where you can get it as a mom and it protects your child for 6 months. Things like that are what moms need to be able to have tools to protect their child. And I think it's important to think about that. And that we also now have lactation consultants who are educated about the work of their immunity and how we can pass immunity to our babies. And that didn't just come from a doctor, it's coming from lactation consultants talking about antibodies. I'm a nerd. I was so excited that my lactation consultant was talking about antibodies and how they work in macrophages. I almost lost my mind. So I'm so excited about the expansion of the team, and I'm excited about the science that's being done for these vaccines.
That is so true. And also coverage, right? Some coverage and plans already included that, depending on where you are and what care plan you may have had. But that is incredible. And I also think we've been doing work even with employers. And to your point, thinking about how they're thinking about this differently, right? Work is a community as well. And so if you're going to also have and support people, you want to make sure that they have those resources as well. I'm going to follow up just in case folks are interested in learning more about how to get access to lactation support for that purpose. Maybe there's a clinician on the line that's never thought about that. So Emily, will you humor me and share a little bit about what you would recommend if someone would like to get connected with the lactation support? person. And Latasha, if you have any suggestions. And we did include the link to Ashe Birthing Services in the chat, so you can also visit their site as well. Emily?
Thank you so much. Yes, if you are New York City based or New York State based, we have a directory to find lactation providers and other perinatal health professionals called the Bridge Directory. And otherwise, I would check with your local birth workers, your mom groups, or neighborhood groups to find lactation consultants and IBCLCs, International Board Certified Lactation Consultants, near you. They are sometimes covered by insurance. And sometimes an out-of-pocket cost. It depends your insurance provider and employer. But they're definitely accessible and in your area, and also, you know, in work together with your providers in the hospital setting.
That's such a great point. Thank you. Latasha, did you have anything else you wanted to add about resources towards that for patients?
Just always be empowered to ask about lactation support. A lot of times women get a little frustrated, and they kind of keep it to themselves, but your primary care doctor is a good place to get some resources. And even if we don't do it, we have organizations that we work with that we can get you to wrap around. Again, we're a family, we're a part of the team. And if you need something, just ask, because we definitely have connections that we can connect you with.
That's an excellent point. And Dr. Logan, I'm not going to assume you don't have anything you'd like to add, but if it's not a lactation resource, but one you'd like to highlight that you found has helped to support your patients in their maternal vaccination journey,
Yes,
share.
thank you for bringing up the postpartum care. So obviously there are some patients who are hesitant to receive the vaccination while they're pregnant, but that doesn't mean they can't get it right after they deliver. So right after they deliver, there is still some benefit through passive immunity through the mom's milk. So, you know, if they want to get Tdap, if they want to get the flu shot, if they want to get even the COVID shot, to be honest, all of those are still avenues of getting vaccination for the mom for her health and still providing some protection to the baby. It's not the same degree, of course, but there is some immunity that's passed through the breast milk.
Thank you. That's actually really helpful. And we know there were so many questions during COVID, and I think we're still working towards answering those. So thank you for highlighting that. That's conversation, I think, at home, in the medical office as well. I'm going to go to our wrap-up question, but before I do, I know that there was a question in the chat, and we just wanted to highlight that we are focused on the maternal piece today in this conversation. And we're not specifically highlighting vaccination for newborns, but I know we are working on a follow-up potentially. And so maybe that's a question or a topic we'll explore in that next step webinar. So thank you for that. And as we go to close out, I'm going to end with hope, I think, and it's very fitting. I'm wearing my red today for Henrietta. And hearing all of your responses, I was so excited because if you think about it, it's been 73 years, right, since her passing, since the announcement of her HeLa cells. And I've heard informed care today. I've heard informed consent. I've heard patient voice. I have heard equity, all of these terms and things that, to your point, Dr. Logan, not just as a Black woman, right? There are so many groups that for years were not asked or considered these things. And to be here in 2024, having this conversation around vaccine and maternal vaccination and looking at it through this lens, I think we're making a lot of progress. So, what is giving you hope in this space? And hopefully, if you're listening in, this may inspire you in the work that you're continuing to advance. So we'll start first with Emily, because you're wearing red lipstick.
I didn't know it was for Henrietta, but I'm happy to say that now. So what's giving me hope is conversations like these and talking about all the different roles that we have to play. And also putting community stakeholders in leadership is really important in addressing maternal inequity and is essential for fostering inclusive, effective, and equitable health initiatives that are responsible for the needs of the populations we serve.
So true. All right. Dr. Logan?
Yeah, I think the thing that makes me hopeful is that, as I mentioned before, I think hesitancy has gone down. People are masking up and being appropriate out in public, even in the hospitals, everywhere. They're really thinking about their own well-being. And that's true for pregnant and non-pregnant patients. And, that's even true in the communities that we serve at Columbia. So that makes me hopeful. What's also hopeful is that the fact that now COVID is I don't want to say it's an afterthought, but it is something that is controllable. Before it was like, almost like a doomsday diagnosis. But now COVID, it's honestly like the flu or like the cold. And I think when people realize that and they see that's the effect once they're vaccinated, then there's definitely more acceptance. Then there's less hesitancy, and people realize the true benefit of vaccination.
That is so true. And Dr. Latasha.
Yeah, there are three things that give me hope. One is our future. I'm an educator, so our future is so bright when you have future doctors building apps and creating systems, and they're open to hearing from our patients and being less of a patriarchal relationship in medicine and more of one of a team. And the second is the team. The team is expansion. We're putting respect on the name of our community providers, our doulas, our community health workers, our social workers, our nurses. The team is connecting, and we're connecting in a real way that's making a change in our health and for our population. And lastly, like for me personally, being able to share my story. You put on that white coat and it's all about you being a doctor. But the truth is, in being a doctor, you also have a story. I'm also a birthing person. I'm also a mother. And being able to share that story and be vulnerable and educate my patients enough for us to connect and talk about the things that I'm also concerned with. I'm so proud and happy that I'm able to do that. And we're able to do that in a safe space now, and that it's acceptable and it's okay. So I'm super excited that we're having this conversation and that we can our future definitely looks bright.
Oh, thank you so much. I'm going to take a point of privilege and say that what is giving me hope is you, right? The panel, to see one, care teams coming together, not in silos. I remember the early days where it was like, oh, care, a coordinated care. And we are here together and advancing it. And it's not just something that one healthcare system is experimenting with. This is a model that we are embracing, and we are putting patients first. So I thank you for that. And I really feel that you are Henrietta's wildest dream, right? Clinicians that are also listening to patients, but sharing their own stories and humanizing this journey together. I'm going to close out by making sure people know how to connect with you. So whether it be interest in working with you in your own communities or supporting the work that you do. So we'll start first with Dr. Latasha, because I can see you still highlighted on my screen. How can people connect with you? And if you can share your information in the chat.
I'll definitely drop it in the chat, but I'm on LinkedIn. I'm also at MedStar Georgetown University Hospital. I'm the DC site. I've done some work with Fund 2 Foundation with the Nurture Her series. Please follow that and check in, check up. We can talk some more. But I'm here, and I will drop my information in the chat, and I'm always willing to talk and give more information if you need it.
Thank you so much. Emily, how can we connect with you and your work?
I'm also on LinkedIn. I will put it in the chat. And my two organizations are Ashe Birthing Services, which is the doula team, and the Bridge Directory. Thank you so much.
Thank you. Dr. Logan?
So I'm at Columbia. I can be found on LinkedIn as well. Everybody's on LinkedIn. And, certainly I put my information in the chat. If you have any questions, I'm involved in not just clinical care, but also medical education at Columbia, and, always looking to continue studies towards health advancement in our community. So look forward.
Excellent. Well, I want to just say a very big thank you to each of you for taking your time out on this Friday, to the group of folks that have joined us and have asked questions. Hopefully you've engaged in the chat and learned some things that you can apply to your work. Today, as I think about the closing three kind of things that come to my mind, we know that we are looking at caring for our most vulnerable. And to do that, it's got to be patient-centered. I think that was very clear that we heard that throughout the conversation. We have to make sure that there is equity and access. And lastly, it's everyone's responsibility, right? That includes industry, pharma, clinicians, That includes our community, our birth workers, and even our patients. And I think that if we continue with this approach, we are certainly going to look at a healthier world for birthing people and their babies. So thank you all. I'm going to thank National Minority Quality Forum for continuing to convene these webinars to educate. I do know that they are recorded, so if you had to leave early or you'd like to share this, they will be sending the link that you can watch on demand or share with your colleagues. And lastly, I'd like to thank the team at Pfizer, an incredible group that have really made sure that we had the opportunity to explore really what this looks like. And that's always such a gift, right, when you work in this space. So thank you again. And I'm going to go ahead and wrap up. So Ashley, if you'd like to close out, I'm going to hand it over to you. And thank you to Emily, Dr. Alagan, and Dr. Latasha.
Thanks so much, guys. Everyone have a good day.